Welcome to the News at 11. I'm Denise Koch. Tonight, tens of thousands of Marylanders are scrambling, looking for a healthcare provider. Earlier today, Johns Hopkins and UnitedHealthcare announced after months of negotiating, they were unable to reach a deal. That means one of the state's largest medical providers is now out of network for many. Tara Lynch joined us now in studio. And Tara, we're talking primary care physicians, pediatricians, on and on. So what comes next for most of these patients?
Yeah, Denise, many of us will need to find new physicians, myself included, but some people in continual care may be able to keep their in-network benefits, at least for now. I spoke with an independent patient advocate who has had treatment for cancer as well as 2 transplants. She says this is added stress that could make it just unbearable for patients.
If I had to be in the situation that they're in right now, I don't think I would be here today talking to you.
It's a burden Jamie Imhoff knows well, having major medical procedures and dealing with insurance. She's a cancer survivor and has had 2 transplants. This back and forth dispute between UnitedHealthcare and Johns Hopkins Medicine is putting 60,000 Marylanders out of network. She says transplant and other long-term care patients could be feeling the impact the most.
There's an entire year that you have to go to that you're married to the hospital that you're transplanted at, and literally no other system will take you. So you're stuck not knowing what to do.
UnitedHealthcare says Hopkins' terms would harm its members and employers. In a statement, the insurer said Johns Hopkins refused to move off contractual terms no other health system in our network requires, including language that would allow it to deny patients access at its discretion. In the meantime, some patients in continuing care could still be covered, but it's inconsistent.
One patient was told that they're only going to receive 90 days of care. Another patient said that they are not going to receive any care whatsoever, even though they are a transplant, have to go see these specialty doctors.
Johns Hopkins says it's prioritizing patient protections and improving access to care. In a letter to patients, Hopkins said, quote, "We will not sign a contract that allows an insurance company to prioritize their profits over our patients' health." It also promised to continue negotiating. But who's to blame? Imhoff thinks the responsibility falls to UnitedHealthcare.
I am tending to lean towards more responsibility on United taking care of its members, its paying individuals that are counting on United for health care. I think the burden lies on them.
We're also learning UnitedHealthcare patients at Capital Women's Care have also lost in-network coverage. Jamie Imhoff recommends knowing your options, talking with your provider directly, and have your medical records in hand. It's worth noting if you're receiving certain specialty care, you may still be able to receive care at Hopkins. Call UnitedHealth to determine if the care you're receiving is approved as in-network. Denise?
Very confusing and concerning. Thank you, Tara. Well,